Once I began to understand it myself and I began to research it more myself, I got big aha moments and went, okay, that's why that happened. That's why this person didn't manage to get over this. That's what's going on there. So I was joining the dots together.
Welcome to this episode of Finding Your Range podcast with me, Jeannie. I'm your host, and this is the podcast that talks about hypermobility, EDS, and chronic pain. And today we're joined by Dinah Simon from Menopause Pilates. So you can guess what we're going to be talking about. And I'm really excited because we're going to have a real learning experience today. And before we delve into the details and the questions, I'm just going to read you a little bit about our guests. But thank you for joining us, Dinah. Really excited to have you here.
My pleasure. Thank you very much for inviting me, Jeannie.
Oh, no, I'm really, honestly, I'm super excited because as many people know, I talk about this in a lot of my stuff, but I'm also going through the menopause. So a personal interest to what you're going to be talking to us about today. So let's hear a little bit about you. You've been teaching movement for many years, and you started with jazz dance and aerobics in the 80s. And then you moved through to Callanetics, to Pilates, to the Franklin method, Gyrotonic, yoga, and meditation. So lots of things. And you've been teaching Pilates in the Cotswolds in the UK, where you live, since 1999, and opening your own studio, Contemporary Pilates, in 2001. But you've also studied Myofascial Anatomy, Fascial Fitness with Robert Schleip, and you're a meditation teacher. That's amazing. Lots of things. But during all your years of teaching and experience, a big curve of your clients have been menopausal women. And so the menopause, and we're going to hear about all the things you've been doing in relation to this. But as you say, the menopause can be a time of enormous opportunity if we can feel empowered through education and awareness. And so Menopause Pilates, your company, is an integrated approach inspiring women and teachers through movement and education. That's fantastic. How interesting. You've got an amazing background, haven't you?
It's been a busy old time in the past 20 years or so.
Yeah, amazing.
Yeah.
But yeah, and like you say, this is a great opportunity, isn't it? Because we all, obviously it comes to all of us. And yet until recently, I don't really think the menopause was really talked about very much. When I remember my mum, who is no longer with us, but when I was around 13, 14, she was going through the menopause, and she had these patches stuck on her thighs, and I just remember, and she'd have hot sweats all the time, but she was incredibly moody and pretty nasty at sometimes. And I was thinking, oh my God, I don't ever want to go through, I'm dreading that. I had this real fear about it because of what I'd seen, and she'd be complaining about it all the time. And I was like, this is horrendous. I don't want any part of this. But here we are. And I'm enjoying the menopause myself, we shall say. Yeah. So we've heard a little bit about your background. Why did you choose to focus on this particular speciality?
Well, I think it's been something which I've been aware of for so long. And like you, I mean, my understanding of the menopause, my mother didn't talk about it. She had me when she was 41. So she had quite a late menopause in the end. But she, I remember now when she was going through it by what was happening. But at the time, she didn't know that what was happening to her, like palpitations and dizziness, she didn't recognize that was part of the menopause. And there was no conversation about it at all. So in my work, in my teaching, again, like you, there was kind of this sense of, the menopause up there in the future, you have to get through it type of thing. It's like a rite of passage as a woman, and you just got to do it. You have no choice, but let's not think about it until we have to, because it's obviously a terrible thing. So you have that, it's because you've sort of gained that by osmosis somehow. It's just sort of seeped in, at least in our society, or where in my community, not necessarily in other parts of the world. And then working with my clients, once I opened my studio in 2001, I'd been teaching in a studio in Oxford, and I'd been teaching at Bisham Abbey. I've been teaching athletes. I've been teaching older women. I've taught all sorts of different people. And then I opened my studio. Of course, the demographic who were coming to me in the Cotswolds were more towards the sort of 40 plus age group. So I started teaching more and more menopausal women. And then in 2002, we had the World Health, the WHI report that came out, Women's Health Initiative, sorry, that came out saying that HRT was not to be taken. And I remember very clearly many of my clients coming off HRT overnight. And then I remember watching what happened to them when that occurred. And the thing, so I was clocking things about my clients as I was teaching them. And thinking, okay, is this just the aging process? Is this anything to do with the fact that they now don't have an AHRT, that or this one is menopausal, or this different things that over the years I was watching. And I was doing, like many teachers, lots of different training, as you said, partly because I love movement and I was fascinated and I wanted to learn more, and partly because I wanted to support my clients more. The two go hand in hand. And this feeling that, there's something which I need to be able to help my clients with. I need to make things more accessible for them. So like most Pilates teachers, I was doing add-on courses about different things, including things like osteoporosis or scoliosis and this sort of thing. Your course, for example, which is fabulous. And I always promote on my training to teachers that they should be looking at your book and following you.
Thank you.
No, absolutely. So, all that was going on, and I obviously got older. I had another baby and I kept working. And so all this is happening. And then eventually I reached my perimenopause, and all the questions which I'd had, which were kind of floating around still, because nobody had sort of addressed this for me in the trainings I'd done, many of them fabulous trainings, but they hadn't been addressed. It all began to slot into place. Once I began to understand it myself and I began to research it more myself, I got big aha moments and went, okay, that's why that happened. That's why this person didn't manage to get over this. That's what's going on there. So I was joining the dots together. And I was doing more research. I did a menopause yoga training, which was great because it got me into thinking about it more and more. And then I decided to actually, from my own experience, that I wanted to not only support my clients, but support teachers, because I felt very strongly that this is something we are expected to deal with right from day one, but actually we're not given the whole picture. So it's a mixture of experience, teaching experience, and my own personal physical experience of perimenopause and menopause.
Wow, very important. Yeah, really, really important. So we talk about the menopause, but many of us don't really know what goes on. I mean, what actually happens in the menopause. Could you give us a little biology lesson? Take us back to school and sort of tell us what's going on.
See, this is another thing I feel very strongly for women, is that, if you have a baby, then everybody's paying attention to you. You read books about it. You're there, you get all the information. When you're a teenager and you're going through puberty, your parents or your carers or, your school, they're all on it. They know you're going through it. But women who are going through menopause, they're out there on their own. There's no kind of way or hasn't been any way to bring this information to them. And there hasn't been the drive to do that. And I think that's one of the issues, that this term perimenopause, most women hadn't even heard of it. I hadn't heard of the term perimenopause. It was just menopause. Everything was menopause. So, we've actually got puberty, pregnancy, and perimenopause. We've got 3 Ps that women go through, or any biological female. If you are assigned female at birth, you will have a menopause at some point in your life. So it's all about the fluctuation of hormones, the depletion of the hormones which have been with us and doing everything we need in our system since puberty, basically. So if you like, it's the reversal of the reproductive cycle. So we've had a body which is capable of reproduction. And as we reach this time in our life, that is going to change. So menopause itself means you can no longer have children. So, you know, it means that the hormones, estrogen, progesterone, and testosterone have gone down to the level where, you know, you're not going to get pregnant any longer. But the menopause itself is 1 day.
Is it?
Yes, it is 1 day.
Oh my goodness. So how does that work? How does that work? I've never heard that before.
Yeah. So basically, it's the 12 months after your last menstrual period. Okay. That 1 day, 12 months after your last period is your menopause.
Wow.
So lots of women never know when it is.
No.
Lots of women don't know until in retrospect. Okay. Everything up to that point is your perimenopause. Then you have your menopause that 1 day, and then you are postmenopausal.
Wow. That is news to me. I did not know that.
A lot of women think that they're going to go through the menopause. So it's like, I have to go through this stage and then it'll all be okay again. I thought that. And actually, you go into postmenopause, you do not come out of it. That's it.
Oh, I'm getting really depressed here.
No, but the thing is, it sounds depressing, but it's not. I mean, it's just that what is important to understand is that your body changes. You have a new state of being, and that is the state of being you will have for the rest of your life. Okay, so you know, many women live a long time now, so a lot depends on how your body adjusts to the change in hormones. That's why we're also individual. That's why you know, one size doesn't fit all, and it's just figuring out what suits you in your postmenopause, perimenopause. I mean, we term it menopause, umbrella term, but it's actually only 1 day.
Fascinating. And you know, one of the reasons I wanted to chat with you for this podcast is obviously, you know, our audience tends to be hypermobiles, EDS, HSD. We know that the female hormones have a huge impact in our symptoms. So symptoms often start in either puberty, pregnancy, or menopause. And personally, my symptoms got awfully worse once I hit the menopause. And there's something to do with this change in the level of female hormones, either a surge or a decline. Exactly. It does something to us.
Yes.
And people still don't really know why. There's not a lot of research into it.
No, there's not enough research yet. But there's research on female athletes during their menstrual cycle, on the connective tissue, on knee injuries. There's that research, and that shows that according to the fluctuations in hormones, they can get more serious injury at certain times of month than at other times. And we know that women feel more pain in their fascia than men do. That's been proven. But I totally agree with you. At the moment, it's a whole area of women's health. But this is very important to look at how our hormonal fluctuations affect what is happening to us in the body. Absolutely.
So I know we're going to talk about, you know, exercise a bit later, but you know, understanding this more will obviously help our hypermobile listeners learn how to adapt maybe their exercising to cope with their menopause, so that we don't get injured. And it's a very difficult thing because you know, you don't know how well, because of the nature of perimenopause with these fluctuations, and you don't know when it's happening half the time. You have to really try and tune in to what's happening in your body. And if you've got other stuff going on, that's not easy. So that's one of the reasons it's so important to be very alert, as you say, to what you're doing, because, you know, you can hurt yourself inadvertently. Yeah, absolutely. Okay. And we mentioned this earlier, you know, that the menopause, certainly in the UK, so we're kind of talking UK, but I'm not sure about the US, how vocal they are, you might know. But, you know, Davina McCall in the UK, people listening from the UK will know who she is, but she did that, was it an Instagram story or something, a post, and she was showing everyone how she applies all her different creams, and, you know, and all of a sudden everyone was happy to talk about the menopause, and, you know, how has it suddenly become important?
It's a very interesting point. My take on it, if I think about it, so the menopause doctor, Dr. Louise Newson, who has really been the driving force at getting more information out to women. And I connected with her 2 years ago at her clinic because it's close to me. And in fact, one of her doctors is my doctor, and I've been in and done trainings at her clinic. And I think that she is honestly an absolute driving force, that she is so committed to helping women get information. And we've never had somebody who's been pushing so much. And along with Liz Earle supported her with that. So she started with her Instagram, she started with her Facebook group, she really started pushing. And of course, she's got the Balance app, which is now available, and she's got the Menopause charity, which she's set up. And all of these are pushing to get more information out to women. And so before we went into lockdown, that was steadily growing, but it was still slow. And I recorded a podcast with her actually during lockdown. But once we hit lockdown and more people were actually using Instagram, using Facebook, I think actually it helped the situation. That alongside certain celebrities writing books. So you have Davina, of course, you've got Meg Matthews, who's written a book. Liz Earle wrote a book. So it began to be a popular subject. The timing was right. Mixture of things came together. It's a bit like, when with Pilates, it had a certain number of goes at becoming popular. It wasn't until the mid-90s that actually it stayed. In the 70s, it sort of had a bit of popularity and then it disappeared. Whereas the time is right. And I think more and more women want help. They're recognizing that they can have help, should have help. And I think as it's just a wave which has grown and different people have come on board at the right time. And obviously it does help when you've got big media people who are involved. Diane Danzibrink, who has the Make Menopause Matter campaign, she's been fundamental with this. To try and get the three elements of the campaign are to get mandatory education for GPs, because there isn't any still.
Really?
That is a big problem. And if you think if that is fundamental, because if GPs have mandatory training in menopause, then you've got the people in the right places. But they haven't had it. They haven't had, and if you start thinking about that, it is mind-boggling, because of the number of women who will be presenting in their surgeries, and they haven't had adequate training for that.
Absolutely. That explains a lot. From my personal experience going to my GP when I was having like night sweats and, mood swings and things like that, trying to get some help, trying to get, something, and they'd be like, oh no, you're too young. But, perimenopause can start fairly early for some women, can't it?
Absolutely, it really can. And so, Diane's campaign is to get the GPs educated, to get menopause on the national curriculum, which it is now.
Right.
And then she supported the bill which has gone through Parliament to get prescriptions for HRT, so that you don't have to pay for them. I mean, you pay a one-off prescription charge. And so it was very fortunate that Carolyn Harris, the MP, was also on board with this. So it's just been a really good synergistic timing, of different people coming in at the right time and spearheading and pushing it forwards. And of course, the thing also is that menopause has for many years been in the realm of the gynecologist, who is a surgeon, who's not necessarily a menopause specialist. And then you've got your GPs who don't have any training. So you're in a very difficult place, and not many menopause clinics on the NHS around the country. So because Louise Newson wanted to work with menopause in the NHS and she couldn't. So that's why she set up her own clinic, and has then, really opened everything up. Quite controversial for some people, but once you put your head above the parapet, as we know, people are going to have a go at times. But she is really, honestly, she's so dedicated to women's health and well-being. It's very, very clear when you speak to her.
Fantastic. Yeah. Well, we need people like that, don't we, to just drive these things, to make change. Otherwise, nothing will happen.
Yeah.
And people like you, helping educate people like me and other teachers.
Education is the key thing. For me, it's all about education. And I think that's where it's like with the work that you do with working with teachers. If you don't have that information, you're doing your best with what you know.
Absolutely.
And as a teacher, you can't know everything, but actually it's like with GPs, menopause is a very like, it's here all the time. Everybody is at some point going to be dealing with, relating to a menopausal woman.
Mm-hmm.
No way around it.
Yeah. No, exactly. No, very interesting. So while I was researching for our interview, I found some stats, and you can, tell me if they're right. But it said that 82% of women experience menopausal symptoms, and 70% of women have severe to moderate impact on their life because of those symptoms.
Yeah.
Does that sound about right?
Yeah.
Yeah. And so what symptoms common symptoms are people experiencing, and why is that so debilitating for some people?
Well, you've got the classic, which people think about immediately, hot flushes. Mm-hmm. So that's a very common symptom. In the West, it's rated as the most frequently cited symptom for women. But it's a fascinating thing because quite often, obviously in my studio, we talk menopause a lot. And I have clients who say, oh, I sailed through the menopause, no problem at all. And then I say things like, okay, so how's your sleep? Oh, my sleep's been terrible since I was in my mid 40s or late 40s. Okay, and what about your anxiety? Oh, I get terrible anxiety, yeah. And, things which, because there hasn't been the education, women don't necessarily know are perimenopausal symptoms. Mm-hmm. And because we have receptors for estrogen everywhere in our body, as it depletes, it means that anything in our body can be affected. So you have this vast range. So for some women, maybe they will have hot flushes. For other women, they'll have hot sweats. Some women will have palpitations, heart palpitations, which are very frightening. Other women will have very itchy skin. Some will be dizzy, some will faint, some will have head rushes, extreme fatigue, joint pain, muscle pain, things which are very familiar in the chronic fatigue and hypermobility range. So yes. Not similar in that respect. Burning skin, issues, dry eyes, dry skin, hair, nails, all of these things, gum problems, teeth problems, what else can we go? There's a great long list of all these things.
Yeah.
Electric shock sensations, vomiting, you name it. They are all symptoms. And then you've got the symptoms connected to the urogenital health. So vaginal dryness, itching, soreness, problems with the bladder, UTIs increasing. You've got pelvic floor issues. It's everywhere. So
very interesting.
And it may be that some women just don't realize that is a symptom of perimenopause, the fluctuations. And that is one of the issues, because if you don't know, if you haven't got the information, you can't respond.
Well, that's just making me think, because like you say, most of those symptoms you read out can impact our hypermobile community. So
absolutely.
Is it that this change in hormone levels just makes our symptoms worse? So the things we were already experiencing, maybe again, it's just me thinking.
It's a really interesting question, because you can also question, over the years, I've taught many women who have got chronic fatigue or fibromyalgia and hypermobile, and, all of the chronic fatigue, fibromyalgia group, they are all hypermobile, full stop.
Yes. Yeah.
But then for a lot of them, having the digestive issues, again, menopause causes digestive issues. Having histamine intolerance, again, menopause causes histamine intolerance.
Didn't know that.
You can the reduced progesterone means that you can suddenly develop an allergy. So my sister, for example, got hay fever, never had hay fever before. So, or something that you can get more histamine intolerant to different foods as well, and drink, obviously. So it's a tricky one, because if you are diagnosed with a chronic fatigue type condition at the same time as you're going through perimenopause, which is it? Very hard.
Very hard. Yeah. Gosh. Yes, it is a minefield, isn't it?
It is. And, we are so finely balanced hormonally that you put one shift in and it can just cause so many problems.
Yes.
If you've had post-traumatic stress disorder, again, get into perimenopause, that can bring it all back out again. So So many things.
Yeah. And I think, people with, our connective tissue disorders are very aware of their bodies anyway.
Yes.
We just are, because we tend to have issues all the time. So we're going to notice probably changes that maybe other people don't notice.
Yeah.
And we tend to be very sensitive. So we react. We've got inflammatory tissue, so we react very quickly.
Yeah.
So, like you say, if those hormones start to go out of balance, we're going to really feel it. So I think that could be what could be going on. It's fascinating. It is. So let's talk about exercise. Do we need to train differently or exercise differently, and why? Well, we talked a bit about why. So why should we and how should we train differently? And you mentioned the pelvic floor earlier. Should we be thinking about our pelvic floor health now?
I think we should always be thinking about our pelvic floor health, but I think the thing is that your population will be exercising appropriately, because they will be exercising for their hypermobility, for EDS, for chronic fatigue. And actually, menopausal women can take a leaf out of your book on that, because what happens for a lot of women is that they are used to doing quite strong exercise. Maybe they're gym bunnies, or they like running. And then with the hormonal depletion, they start to get injuries because we don't repair in the same way. They get the collagen issues come up. And so they might hurt themselves, and it takes longer to get better. And then they hurt themselves again. And there could be too much stress and strain on the body. So if you think about the typical woman who is possibly she's got older parents and teenage children and a career and running a house and all the stresses and strains that go into that. So stress levels are high anyway. You add in the fluctuations of hormones, that increases that. More cortisol going through the system. And very often they will go and say, I need to go for a run to deal with that, but possibly then get injured and not recover so quickly. So it's changing your mindset about your exercise to say, okay, yes, I do still want to keep my strength up. You have to keep your strength up, because we know we start losing muscle mass and we need to maintain strength, and we have to bone load because we know that we start to lose bone density. But you have to do it in a way which is nurturing to your body. And that can be one of the hardest things for women to understand and accept. And for me, that's why Pilates is so good, because you can modify to where it needs to be. You can up the challenge to where it can get to, but it's very safe and it's not stressful. And actually, we don't need stress in our bodies. So we want to calm that down. So it's trying to get women to understand that slow and small is good.
Yes.
Which is what you're already doing anyway.
Yes. Oh, well, fantastic. That's good to hear that the two kind of marry up.
They do. Yeah.
And I think combined with something like, because I want to ask you about mental health as well, but combined with something like meditation is going to be really important, right? For calming the nervous system and just bringing balance back to the system.
Exactly. Yeah. It's all about balance. And the British Menopause Society, when you read their guidelines, they do endorse yoga as an exercise for menopausal women. I'd like Pilates to be in there. So I have to find a way of getting that in there, because it is about having something mindful, something calming, something which works the whole system.
Yes.
And that's important.
Yeah.
So, I agree. And meditation is fabulous. One of the problems which can arise is if you're, say one of your symptoms of menopause is anxiety, and you have extreme anxiety, then to sit and meditate, it's not going to happen. Yeah. So it's recognizing that going for a walk in nature, or having a bath, or doing some gardening, or cooking, giving yourself time just to have something which you find therapeutic. Maybe it's knitting, maybe it's sewing, maybe it's painting. That's your meditation. Yeah. Because to sit and meditate, for me, I've been meditating for a long time, and I have taught on a faculty teacher training, and I teach it. But when my anxiety was bad, and it was seriously bad, I couldn't meditate. No way. So, it's not giving yourself a hard time about that as well.
Yes.
Because there's a lot of talk in the media about, you should have this app and that app, and you should meditate, and meditation is this, that, and the other. So then it's another expectation that we create for ourselves. Oh, I should be meditating, or I should be doing that. It's like, whoa, hang on a minute.
Yeah.
So, it's possibly lying on the floor with your legs on the sofa with some music on for 10 minutes.
Yeah.
It's whatever it is for you to calm your system.
Exactly. And everyone's so different, like you say.
Yeah.
Absolutely. And you mentioned anxiety. I remember I went to a talk at the CIPD. I was presenting there before pre-pandemic. And there was a lady there doing a talk on the menopause. And that was the first time I'd ever had lots of information about the menopause, which seems crazy, right? But this was a lady who used to run I think she had her own company. She was very high powered. She was speaking at conferences to thousands of people. And then all of a sudden the menopause hit. And she said that she couldn't even get in her car and drive to work because she got so anxious about whether there'd be a parking space, whether she could do this, and she'd be sweating. And obviously she had to totally change her whole life because she couldn't do that job anymore. How can that happen? How does this thing change us like that?
It's very common. And this is one of the big problems, that we lose so many experienced women because of menopause symptoms. And very often they go to their doctor, and because doctors don't have training in menopause, they get given antidepressants because, to be fair to the doctors, they're confident with the antidepressants, but they haven't been confident with HRT. And and again, Louise Newson talks about this. Many people I talk to say the same thing. This has happened to them. And we really are, we have these women who are wise women, who have experience, who have time coming up, and then they feel like they're falling apart. And again, it's all down to the hormonal depletion, because it affects our brain, it affects our nervous system, and anxiety is physical, emotional, mental, the whole thing. And I can completely understand how she felt. I almost closed my studio. I thought, I just can't do this anymore. And the anxiety becomes catastrophizing. It gets really bad for many women, but it's the hormonal imbalance.
Yeah. And you mentioned HRT, and I wanted to ask you about that. So the lady I was speaking about, she said that the thing that changed her life, she actually got put on HRT, and all of a sudden she started to feel like her old self again. So what are your thoughts on HRT? Because as you say, there was all that scaring about, you shouldn't do it, it gives you breast cancer, and what are your thoughts?
So I think that it's, there was a lot of damage from that report back in 2002. Overnight, as I said, millions of women came off HRT. And for those of us who are in our 50s, so probably 40s to 50s, we've just grown up basically with this notion that you can't take HRT, it'll give you breast cancer. And we've just absorbed that by osmosis. And if you've got any breast cancer in your family, don't go near it. Which is, for me, I didn't go near it because my mother had breast cancer, and because I've had a number of biopsies and I have a breast growth, which is still there. So I thought, I can't take HRT. I was sending other women to menopause specialists because I knew where to go, and I recognized that I was in perimenopause, but I still didn't understand at that point that HRT is not the demon it's been made out to be. The research was flawed, basically, and the way the statistics were presented was inaccurate. And there are some really good reports now about what happened. And now there's a lot of research which shows that actually it was completely wrong, what we were told. So also you have to remember that it's going back to the late 90s into the early part of this century. And so the type of HRT was very different to what we use now. So now we use this type, which is called body identical HRT, and it's derived from yams. Yes, of course, it's synthesized, but its base product is the yam. In days gone by, the base, what it was made from, was pregnant mare's urine. So it was a very different thing. And you took a pill. So the pill had to go through your liver. So there were more issues with possible side effects and problems. The research that was carried out, when they looked at the women who had been on that research, they had many other things which would be considered risks for breast cancer, like being obese, like being smokers, like, all this kind of thing. And the thing to remember about estrogen is that of itself, it's not a carcinogen. The issue arises when there's a tumor which has got receptors which like estrogen. And we've got these receptors all over our bodies. So sometimes there's a tumor which likes the estrogen, but of itself, it is not going to give you HRT because, sorry, not going to give you cancer. Women have thought, I take HRT, I will get cancer. It's not correct. So what we have to understand is the benefits of it as well. And everything we do and everything we take has a risk and a benefit. And you have to weigh up, which is why it's very important that GPs get the training so that they can work with their patients and say, okay, let's look at your risk factors. Now let's look at what the benefits would be. Let's consider where you are. I reached the point personally where I was in so much pain and I'd got such bad anxiety and everything was so hard that I thought, if I actually don't go and get something, I'm going to get ill. So even if I only take it for a short time, I have to do this to get myself out of where I'm at. And again, you don't have to take it forever. You can, but it can be the bridge to get you back to your self-care. And that's the thing about HRT, because the only way to replace missing hormones is with HRT. Now, it's a choice. And I know for some women, they don't want to take it, and some women can't take it. But we're talking about systemic HRT, which you put on your skin. So you have a patch or a gel or a spray or an implant. So it goes straight into your system, doesn't go through the liver. So clotting is not an issue. And it's shown to actually be beneficial in terms of things like blood pressure and actually keeping the blood flow through the arteries. So for cholesterol issues, this kind of thing. And it depends, on your symptoms, really. But it's important to educate yourself about what it does for you. And it's also important to remember that it's a bridge. So for me, it meant that I got back to a point where I could practice my exercise. I could do my meditation. I could look after myself. So you still have to have all your self-care in place. It's not going to do, if you say, okay, I'm going to have HRT, then I'm going to have a bottle of wine a night and I'm not going to do any exercise and I'm going to eat cream cakes, then what's the point, But, to me, it's very much, I really like the term which one of the doctors has started using, which is holistic HRT. It's part of your whole holistic treatment for yourself. And in many ways, it's a preventative form of replacement therapy, rather than saying, okay, when I'm older, I will have to have biphosphonates for my lack of bone density and I might need statins because I've got cholesterol issues. Let's look at it the other way around and say I'm going to replace the hormones so that I don't have diminishing bone density and my cardiovascular system is going well, because one of the biggest killers of women is heart disease and dementia, the two together. So for me, I think it's something that we need to know about so we have a choice.
Yeah, fascinating.
And with the hypermobile population, I think it's very important that they know about it because of needing to maintain strength.
Yeah, absolutely. And I was just thinking while you were talking, I know there are going to be people listening who, and you mentioned it, they can't take HRT because of different things going on. Are there any natural ways that we could manage our menopause?
Okay, so there are ways to manage your menopause. If we think about HRT, you've got the systemic type, which goes through the skin, which goes through the whole system. And then you've got what you call topical HRT, and that's the vaginal HRT for any symptoms like prolapse or urge incontinence or pelvic floor issues or constant bladder infections, urinary tract infections. And the research shows that anyone can take this. So it doesn't matter if you've had, I've worked with clients who've had breast cancer, who've had their ovaries removed, and they can still use this because it's tiny. The amount is so small, but it makes a massive difference. So that type of HRT, if you've got any urogenital issues from menopause, please see somebody because it can be so helpful. And that's really important, I think, to know. Yeah. Then in terms of other ways to support yourself, well, there is CBT, cognitive behavioral therapy, is recommended. Counseling is recommended. There's certain evidence-based ways of managing your menopause which are supported. There are some other drugs which are not HRT, which can be given to help with hot flushes, that sort of thing. They may have side effects. But if you are a woman who cannot, for whatever reason, take HRT, but you want some kind of help, then absolutely push with your GP to get something, to get a referral to a menopause clinic.
Yeah.
And there's a really good book, which I have got here. 1 minute. I'm sure, like you, I've got books all over the place here.
Oh, yes. Yeah.
One by a doctor called Dr. Anis Mukherjee. She's on Instagram, and she's an endocrinologist. She's had breast cancer herself. So her book looks at all sorts of different ways as well to support yourself through menopause, because she's very clear, that it's not something every woman can take. There is research going on at the moment to try and find other ways, medication ways to support women who can't take HRT. Okay. And of course, over centuries, women have been using supplements to help themselves as well. So, the thing is that the only thing that actually replaces hormones is HRT. Everything else is about managing your symptoms.
Yeah, that makes sense. Yeah, thank you. Thank you for that. And coming back to the exercise and, that being part of our self-care.
Yeah.
What barriers might we have to exercising during menopause, and can we overcome them?
Yeah, I mean, very often extreme tiredness is one of the problems. Yeah. Weight gain is another problem. Pain is another problem. So actually getting yourself to exercise can feel really hard to do. And that's why I think Pilates is so good, because we can adapt and modify for absolutely, in my view, anybody. I mean, I teach yoga, I teach Gyrotonic, I teach Franklin method. I love all of those methods. But for me personally, I think that Pilates is the middle path. It's the balanced way, and it's accessible to everyone. So it's finding a teacher. And again, quite often I get contacted by women who say, what do I do? And then I might Google their area and see if there's a studio. And it's about looking at who's there. Yeah. And, too, it's like you read the bio of the teacher. And if you're experienced, you can tell whether that teacher is going to be a fit for this person. Yeah. So it's getting people to actually be prepared to go to a studio or to talk to a teacher, to not necessarily just go with the first teacher they see, but do the research. Yeah. So, and that's sometimes hard, I know, because very often people want us as teachers to tell them what to do. But actually, you've got to be empowered. It's got to be your own advocate and say, okay, these are my issues. I want a teacher who is old enough to understand what I'm talking about, experienced enough to know that they're going to need to modify the movement, and actually somebody I relate to and I can enjoy this session. So having a one-to-one and then deciding where you're going to watch the teacher teaching, really good. If the teacher says, I know it's hard at the moment with the COVID conditions, but ideally you would get to watch the teacher in action. Yeah. Because then you know. I mean, I've always said to people who contact me, I'll say, if you want to come and watch a lesson, just come. It's absolutely fine, because they need to have an idea of what you're doing.
Yeah, that's so. Listening to you say that is exactly what I say to my clients as well. Don't be afraid to interview the teacher.
Exactly. I've been interviewed so many times.
Yeah. It's good. It's good. Yeah. But I think people are a little bit afraid, like you say. They think that the teacher is in charge and they have to do what the teacher says. But actually, when you're dealing with these kind of issues, you've got to be able to say, actually, no, I don't want to do that. Exactly. Or I can't do that. And not feeling bad about that, like you say. Exactly. If the teacher's not prepared to modify for the person, then they're not the right teacher for you. Yeah. And that's okay too, because you will find someone. There's lots of wonderful teachers out there.
Yes.
And you mentioned, just briefly, weight gain could be an issue. Why do we put on weight?
Yes. The middle age spread.
Yes.
So the thing about, once again, hormonal depletion, our metabolic rate is affected and our digestion can be affected. And we change how we gain weight, how we store fat, if you like. The body starts to store it around the middle. And that's because in that fat around the middle, the body can make a little bit of estrogen.
Oh, is that why?
Yes, because we still have a low level of estrogen in our bodies, but not what we've been accustomed to. And it can be produced in that fat.
Oh, I don't feel so bad about it now then, if I know it. If it's there to do, you know, it's doing something, it's helping.
It is, but it's also then, as we know, knowing where the fat is it around your organs? Where is it? So forth.
Yeah.
So, and of course, if the adrenal glands can make a little bit of estrogen too, as you're going through the menopause. But if you're very stressed and you've got high cortisol levels, then that's not going to happen necessarily. But for some women, when they've got a lot of cortisol in their bodies, they gain weight. Other women lose weight. So again, it comes down to trying to get the system calmed down. And for me, treatments like craniosacral therapy are so beneficial. Yeah.
Love
because
it.
Just gives you that space and you get the body back to its home. And you know, and it's all about finding that balance.
Absolutely it is, isn't it? Everything comes back to that balance. Oh, I feel I've learned so much in this chat with you. It's been fantastic.
It's been a pleasure. Thank you.
No, I've really enjoyed it. I hope the listeners have too. I've learned honestly so much, so thank you for that. Really.
It's a pleasure. Absolute pleasure.
So how could people, if one of people read more, I know you've told us about that book, which looks really amazing. Are there other things that people can do to learn more, and how can they get in touch with you or find out more about you and your teacher training, of course, that you're doing?
Okay, so in terms of information for yourself about menopause, the Balance app is a really good app because it gives loads of information. It gives guidance on how to talk to your GP, all sorts of things, how to create a health report for yourself to take to your GP, lots of information from other women, what they're going through. Because a lot of what we need is to hear what has happened to other people, because then we know it's normal, or then we know how to manage it and handle it. And that was great when I worked with Harley Street at Home last year, which was a Facebook group, because you really had this community discussing what was going on. And that was so good. So that's a great thing. There's a website as well for the Balance app. So you've got Louise Newson has got her Menopause Doctor website with Balance together. Okay. And that's really good. Then she has her separate clinic website, but the Balance website and app, Menopause Doctor, is excellent. The British Menopause Society, you can go on their website to get information. What else could you do? You can look at the NHS website, that does give some information, and the Menopause Charity, that will give information as well. So lots of information there. Loads of books out now, so you know, take your pick on the books depending on what style you like. And for me, I've got, the Instagram Menopause Pilates. My website is coming, but it all went on the back burner for various reasons. But hopefully by the end of this year, it will be out, and that is Menopause Pilates. So the teacher training is a CPD for teachers, which is menopause awareness, and it's an accredited CPD. And I've just finished teaching it this weekend in Polestar, and I'll do it again for them next year. And then I run it once a month online as well via Zoom for teachers who want to do it.
Fantastic.
And it's had really positive feedback, which is really nice, and I love doing it. So
Well, honestly, you're so knowledgeable about everything. You know, you've answered all our questions so well, and it must be wonderful. I must come on your online course.
Oh, it'd be lovely.
I want to learn some more now.
Well, it's my passion project. Like, I think what you do is your passion project. So, and I think when you have an experience which really cements so you turn theory into knowledge, basically. You go, okay. And then, like you, working with other teachers, you think, actually, this everybody needs to know this, because it makes life better for teachers and for their clients.
Absolutely. Oh, very well said. And a really lovely, absolutely fascinating chat. So thank you for your time. And
My pleasure.
so that's how you can find out more. And I hope you enjoyed that. I hope you learned as much as I did. Because as we said at the beginning, it really is a subject that no one was really talking about until recently. So yeah, I loved it. Absolutely loved it. So thank you. And so until next time, everyone, keep moving.